Brilliant. We'll make a start. So, morning, everyone. Welcome to our South Yorkshire Innovation Hub Bitesize series. Today's session will be on cancer. The lovely Faye Hamer will be joining us to talk about mobile oncology units. So, these webinars in this series will highlight research and innovation best practice all across the South Yorkshire region and will run from September all the way up until January next year. Each month will focus on different themes. So, for example, this month will be cancer. That will then be followed by children and young people's, prevention, workforce, and also economy. In line with the 10-year plan, we do want to maintain the energy around innovation as a massive national priority because this drives progress, enhances problem solving, but it also fosters growth within our areas just to support our health and care industry. Now, we hope you feel inspired by our speaker today. Faye is lovely. Faye will give you lots and lots of information to take away, but we hope that this will also help you gain insight into research and innovation delivery, and also will provide you with top tips that you can take away and pinch with pride back to your own organisations. I'm now going to pass you on to Faye to talk to you more about implementing mobile oncology units.
Thank you, Natalie. Hello, everyone. I'll just share my presentation. Natalie, if you could let me know if it's coming up all right.
Yep, that's perfect.
Come on. Okay, perfect. So hi, my name's Faye Hamer, and thank you for joining today's webinar. I'm here to introduce you to our Oncology Closer to Home model. This is a model that we've designed to support hospitals in achieving their goals around patient care and improving operational efficiencies and addressing capacity challenges. And the company that I work for is Bbraun Medical. So who are Bbraun Medical? Well, Bbraun are a Sheffield-based company, and we're part of the ecosystem of healthcare. There isn't one hospital, I don't think, in the UK that Bbraun doesn't provide either a surgical instrument or an innovative pump or a closed system to be able to deliver oncology medicines. So as well as all this, providing consumables and equipment, we also deliver clinical services to patients in the community. We've been an existing home care provider for over 15 years and have great reputation in the market. We provide care to over 28 hospitals, and we have a CQC rating of good. We're also a member of the National Home Care Association, and we were the finalists for the Nursing Times Workforce. We deliver over 17,000 treatments in 2024, and this is ever growing. And we provide renal services across the country in 9 community units. And as well as this, we also provide stoma, urology and continence care in the community. And as part of all this, we have a team that supports us with pharmacists, coordinators, specialist nurses to be able to support the services we deliver out in the community. So for the Sheffield region, we have been an existing provider for home care for parental nutrition for over 15 years now, with an excellent reputation. And as a Sheffield-based organisation, we're deeply committed to supporting our local community and the wider healthcare system. And we hope to build on this with other areas as well. So, you might be thinking, what's this got to do with oncology, with it being PN and that side of it, with what I've just spoke about there. But what we've noticed is that we've looked at the market and we recognise that cancer services are under increasing pressure. Patient volumes are rising, more treatments are coming down the pipeline, travel to hospitals can often be a major burden to patients, and trusts are facing ongoing workforce and aseptic challenges. And at the same time, there's a clear national shift towards delivering care closer to home, where it's appropriate and safe. So as an organisation, we've recognised these challenges and we've explored opportunities to collaborate with trusts to co-develop solutions that enable delivery of SAC treatment in the community setting. We aim to work with trusts to innovate and establish a service model for the future, delivering value for the trust and patients. And we're confident in our ability to provide a solid foundation for quality service, enhancing patient experience and being a value-added extension of the current SAC service that you might provide. So the model we've looked at creating, this is what we started with, was looking around how we deliver community services. So obviously we deliver home care services at the moment, but when we went out to patients and we spoke to patients about the services that they wanted, they actually said they don't want to bring their cancer treatment into the home setting. A lot of them said they'd still like to be part of like a community. So we looked at different ways of how we potentially will be able to deliver this. So as part of our offering, what we can offer is a fully managed mobile service, which I'll go into in more detail later on. We also have Bbraun estates. So obviously for Sheffield, we've got our Bbraun head office locally, and we've got numerous estates across Sheffield, which we can incorporate into treatment rooms. And we've done this for other treatment areas as well. And then also in some areas, you might have NHS estates that you want to incorporate into treatment rooms. These might be polyclinics, or you might have availability at GP clinics, and being able to utilise them as treatment areas is something that we can work with you to do. And as part of the offering, what we would offer is we've got Bbraun nurses across the whole of the UK, and we would also offer all of our technology within the mobile unit to be able to deliver the treatments, and also we would link in with yourselves around your IT systems. And then as part of that, as I said, we would custom make the service around your current needs, and within that we can also offer aseptics as part of that as well. So we worked closely with a trust recently, and so our service is not yet live, so we've been working with the trust, and we've developed the model in close collaboration to ensure that it responds to real and clinical operational challenges. And within this trust in the region, they wanted to look at implementing a mobile unit to reach patients in deprived areas, and for those that are travelling long distances. And importantly, patients told us, as I said, they want to feel part of a community, and that insight helped us to create looking at a mobile unit to be able to do this. And we're confident that this service will deliver meaningful value to the hospital and the people they serve. So what happens with the particular mobile unit is it's a fully functioning mobile unit, a facility that can travel to different areas within the community to provide SAT treatment for patients, rather than the patients having to travel to the trust. So what we were finding was that some patients were having to travel quite long distances. Even for those that weren't having to travel from long distances, they were still having to set off quite early because of the volume of traffic in the mornings, and also having to try and find car parking spaces, which really did cause a burden on them to be able to come into the hospital. So what we wanted to do is be able to deliver non-complex treatments to patients, and they can receive their treatments closer to home, while still remaining under the direction and care of the consultants at the hospital. So basically, we just want to be an extension of the service that you're currently providing at the hospital. So as I've said, the mobile units are fully functional. They will have all the equipment required to safely administer SAC drugs. So we have, as Bbraun, we currently provide closed systems, so that provides safety for our nurses and also for the patients. And also the mobile unit will be maintained by Bbraun. We will offer fully competent SAT nurses, so they'll be UCONS trained, and they will deliver treatment under the policies and procedures of the hospital. And we will also have administration and management team to be able to help service and support the unit. So this will be a team being able to do to book patients' appointments onto the unit, to be able to manage the unit, and obviously look at the locations of the unit and getting the unit to the actual locations each day. There'll be IT support, and also we'll offer the cleaning service and the security. So basically, it's fully managed on with ourselves, but we're just complementing your service out in the community. And then there will be a pharmacy team who will be responsible for procuring, dispensing, compounding and delivering the treatments to the mobile unit on a daily basis. So what does this mean to the NHS? The introduction of a mobile SAT unit presents a significant opportunity to address current challenges. So looking at increasing access, so bringing SAT services directly to patients in the local communities makes treatment more accessible and more convenient by minimising the travel and costs associated with coming to the hospital. Improving patient outcomes. Currently, certainly with the trust we've been working with, patient whose treatments need to be deferred cannot always get their appointment within that 7 days. So they, which is sometimes an issue for them. So due to the lack of available appointments, it's well documented that treatment delays can have lead to poorer outcomes. So by increasing on-site capacity, it's hoped that more patients can receive their delayed treatments within the 7-day time frame. And we'll look at being able to collect data around this to be able to support this. And then also enhancing the patient experience. So receiving treatment closer to home can significantly reduce the stress and improve overall experience. And I also think it allows the patients to have a choice as to where they want to be treated as well, whether they want to be treated in the community or at home. And then one of the key areas is optimizing capacity. So the mobile unit can help to distribute patient load more evenly, reducing pressures on the oncology day units, and also releasing pharmacy aseptic capacity, which will allow the necessary resources for looking at other complex treatments and things like clinical trials. And then obviously community engagements. The initiative can foster strong ties with communities by demonstrating the NHS commitment to patient-centred care and an innovative service delivery. So as part of the work we'll be doing, what we want to do is be able to demonstrate how our model is going to support the NHS. So we've got a real world evidence team who will work collaboratively with the trust that we work with, and their role is to identify and collect and analyse all the relevant clinical and operational data and patient experience, and this evidence will be used to validate the concepts and quantify its impact and highlight the advantages of delivering a SAC service in the community. And we want to be able to show how the improved accessibility and reduced pressures on acute service will be able to support yourselves in the hospital. So that's a whistle-stop tour of what we're looking to offer as part of our new model. And if anyone's got any questions, I'm more than happy to answer any.
Thanks so much, Faye. That was a really, really insightful presentation. It feels that there are many a benefit to kind of looking into something like this for the NHS. And hopefully we can answer some of those questions if colleagues want to join us later on. Brilliant. Moving us on to Q&A. Let me just quickly scroll through the Q&A in the chat. So to begin, Faye, you mentioned earlier that you are piloting this kind of with another trust at the moment. What would you say kind of so far have been your biggest lessons learned since you've been doing it?
So I would probably say it's making sure that you can get everyone involved quite early on. So obviously everyone's aware of the ongoing capacity challenges and the need to increase capacity with oncology services, but obviously it can be difficult to gain momentum on new initiatives, and trying to get all the right stakeholders involved in that particular project can be difficult, but we see this as an opportunity to strengthen collaboration one with ourselves and across the trust, but we're committed to supporting NHS Trust to be able to deliver this service. And I think because we've now worked with the trust to go through all this, we've got a really clear implementation plan around how we're going to do this, and who needs to be involved. So I think we've learned a lot of lessons from that, and I think that would then be taken through to other hospitals to say, well, these are the people we need to get involved, and these are the steps we need to take. And I'm fully aware in the NHS that everyone is extremely busy, and trying to give time can often be difficult. But I think if us as an organisation can support in whatever way we can to be able to drive the implementation forward, that's what we'll do. And we've now got the knowledge to be able to do that.
Thank you, Faye. It sounds like there's a lot of long-term benefits in regards to kind of making sure we've got the right people in the right room at the start, and then actually the benefits of supporting the workforce via yourselves and that kind of support to support capacity.
Yeah.
Seems like it's I think that's it for the Q&A today. Thank you so much, Faye, for your time, and thank you for sharing that with everyone. As I mentioned earlier, we are running these all the way up until January next year. We'll be running these every single week, so 45-minute sessions, so nice and short, which hopefully can fit into everyone's diaries. But we are always looking for ideas and kind of thoughts on other themes in the future, so please do reach out to us for that as well. Thank you so much, everyone, for your responses there. A massive thank you for attending. So all of our bite-sized webinars, as I mentioned before, have been recorded and will be uploaded onto the South Yorkshire Innovation Hub website for your viewing. I have bobbed a link in the chat for that, so if you do want to click on that, that's where we'll be uploading, just in case you want to share this session with any colleagues. This webinar, as I mentioned before, is a part of a whole South Yorkshire series, but if you do want to book on with us, it's free, completely free. Please follow the link in the chat. But other than that, I am wrapping up. So thank you everyone for your time. Appreciate it.
Thank you, everyone.
Thank you.